The exercise that I'm going to be describing today is push ups. The four major muscles involved in push ups include pectoralis major, deltoids, triceps brachii, and the rectus abdominis. The pectoralis major's origin is from the anterior surface of the medial clavicle and the anterior surface of the sternum. Its insertion is the lateral lip of the humerus. The deltoid's origin is the clavicle, and its insertion is the humerus. Now, the origin of the triceps brachii is the scapula and the posterior surface of the humerus, and its insertion is the ulna. The origin of the rectus abdominis includes the pubic crest of the pelvic bone, and its insertion is the xiphoid process, which is a part of the sternum. Now, for the shape of each muscle. The triceps brachii is bipinnate, the pectoralis major is convergent, the deltoid is also convergent, and the rectus abdominis is parallel. Each of these muscles work together in their own way. The prime movers are the pectoralis major and the triceps brachii. The fixator is the rectus abdominis, and the synergist is the deltoid. The type of lever used in push-ups is the second class lever. We know this because the load, which is the center of mass, is between the force, which is the shoulders and hands, and the fulcrum, which is the feet. Now, here is a diagram showing all the muscles in a push-up. The deltoid up here, triceps brachii on the arm, pectoralis major on the chest, and lower on the chest is the rectus abdominis. Here is a video now showing perfect form push-up.
I'll be talking about hip thrusts. The major muscles involved during a hip thrust are the gluteus maximus, the biceps femoris, the semitendinosus, and the adductors. Their origins are key for generating force. The gluteus maximus originates from the pelvic bone and the lower back, the biceps femoris from the ilium and femur, the adductors from the pubis, and the semitendinosus from the ischial tuberosity. Their insertions direct their actions. The gluteus maximus inserts into the femur, the biceps femoris into the fibula and tibia, the adductors into the femur, and the semitendinosus into the tibia as well. Each muscle's shape plays a role. The gluteus maximus is a convergent muscle, allowing for powerful force generation. The biceps femoris and semitendinosus are fusiform parallel muscles suited for force and range, while the adductors are solely parallel, aiding in stabilization. Hip thrusts use a third-class lever system where effort is applied between the fulcrum, which is the hip joint, and the load, which is your hips moving upward. Finally, the gluteus maximus acts as a prime mover, while the biceps femoris, semitendinosus, and adductors act as synergists and fixators, stabilizing the movement. That's how these muscles work together to create an effective hip thrust, such as this one shown in the GIF.
I'm going to be talking about sit-ups, and the major muscles involved include the rectus abdominis, internal and external obliques, and the tensor fasciae latae, or the TFL. The rectus abdominis origin and insertion is the pubic crest, the xiphoid process of the sternum, and the costal cartilage of the ribs. The external obliques, the external surfaces of the lower ribs, specifically ribs 5 through 12, the pubic tubercle, the linea alba, and the anterior half of the iliac crest. The internal obliques, the iliac crest and lumbar dorsal fascia, the crest of the pubis, the linea alba, and the bottom ribs 10 through 12. The TFL, origin is the iliac crest and insertion is the iliotibial tract. The rectus abdominis and internal obliques have parallel muscle fibers which allow for efficient contraction and movement. The external obliques are unipennant, providing additional strength, while the TFL has a fusiform shape, ideal for stabilization. Sit-ups operate on a third-class lever system. The abdominal muscles apply the effort, the hip joint acts as a fulcrum, and the load is the weight of the upper body being lifted. How it works. During a sit-up, the rectus abdominis is the agonist, contracting to flex the torso forward. The internal and external obliques acts as a synergist, assisting the rectus abdominis by providing additional flexion and stability. Finally, the TFL serves as a fixator, keeping the pelvis stable and preventing unwanted motion.